Dr. Emin Moin today with the topic of antihypertensive medications during pregnancy. So we all know that the first line medications are labetalol, nifedipine and methyl-dopa. If a patient is asthmatic, then you cannot give labetalol, you have to switch to the other drug, that is nifedipine, and the other one is methyl-dopa, which is the third line. So you should know about the doses, how you will start. Labetalol, first of all, you can start with 100 to 200 milligram TDS and you can give maximum up to 2.4 gram per day. So you should know about the maximum dose also. The second one is nifedipine. You can start with 10 to 20 milligram BD and you can titrate it to maximum 60 milligram BD. So you have to tell your patient that he can have a transient headache in the first 72 hours with nifedipine. The third line drug is methyl-dopa. You can start with 250 milligram 2 to 3 times a day. If necessary, you can increase the dose of methyl-dopa to 500 milligram 4 times a day. The maximum dose is that you can give 1 gram 3 times a day. The dose increase need to be gradually over the interval of at least 2 days. So now if the patient's hypertension or the high blood pressure is not responding to the oral medication, you can go towards the IV medication. So first line here again is the labetalol. How you can give the labetalol? If a patient is having a high BP of more than 160 or 110, you can start with the labetalol 50 mg IV over 2 minutes. Then wait for 15 minutes and then you check the BP again. Again you give 50 mg labetalol as a bolus, right, over 2 minutes. Then again wait for 15 minutes. If the target blood pressure is not achieved, you have to go for the IV infusion. So we all know that we have a ampule. 1 ampule of labetalol is of 20 ml and it contains 100 milligram of labetalol. So each ampule contains 100 milligram of labetalol in 20 ml of water. So you take or draw the 60 ml in this range, which is equal to 300 milligram, because 1 ampule is equal to 100 milligram. So 3 is equal to 300 milligram. So this is 300 milligram in 60 ml. So if you divide it per ml, then you will get 5 milligram in each ml. You have to start at 40 milligram per hour, that is 8 ml per hour. We can double the infusion rate every 30 minutes to maintain the systolic less than 150 and a diastolic blood pressure at about 100. Once the desirable BP is maintained, you have to reduce the rate by 1/2. If the systolic blood pressure is below 140 or diastolic is below 90, then you have to stop the infusion and consider the oral treatment. The maximum infusion that you can give is 160 milligram per hour, that is equal to 32 ml per hour. Contraindication to the labetalol are maternal bradycardia less than 60 beats per minute, then you will not give the labetalol. I hope this protocol is now easy and clear for you. Now the third one is IV hydralazine, a bolus injection and infusion also. So if the patient is not responding to the labetalol, then we shift to the next medicine, which is hydralazine. So the main contraindication for this is maternal tachycardia greater than 120 beats per minute. You have to make sure that additional IV line is there. In case of hypertension, you have to consider 500 ml of crystalloid fluid simultaneously. You have to avoid this in the patient with SLE and abnormal cardiac function. And the third one, the main contraindication is tachycardia greater than 120 beats per minute. So we already know that we have 1 ml of the ampule of hydralazine contain 20 milligram of hydralazine, right? So you will draw this 1 ml with 19 ml of normal saline to make it 20 ml solution, right? This 20 ml, now each ml will contain 1 milligram, okay? So 1 milligram per ml would be there in this 20 ml solution. Just like labetalol, first we have to give the bolus doses. After that we have to start the infusion. So first of all, this is about the reconstitution of the hydralazine, how we will form it. 1 ml water for injection. It means that the hydralazine 1 ml is equal to 20 milligram. So we have to dilute it in 19 ml of sodium chloride, that is normal saline. First we will inject 2 milligram of hydralazine every 3 to 5 minutes and then check the blood pressure every 2 minutes. We have to administer or withhold the dose according to response to the blood pressure. We will stop the boluses when the desired BP is attained. Okay, so the systolic should be less than 150 and diastolic about 100. Then if this target is achieved, then we have to stop and consider the oral medication. The dose of the hydralazine which we inject vary from 2 milligram to 20 milligram for the required response to occur. Occasionally the whole 20 milligram of hydralazine will fail to treat severe hypertension. In this case we have to start the IV infusion, right? So we make the hydralazine solution like 1 ml is equal to 20 milligram. So we put normal saline 19 ml to make a 20 ml solution. So now each ml will contain 1 milligram. So 20 mLs will contain 20 milligram of hydralazine. So we have to give the bolus in 2 to 3 milligrams every 2 to 3 minutes, 3 to 5 minutes, and to check blood pressure every 2 minutes. Now coming towards the hydralazine infusion. So hydralazine infusion, how you will make, this is the same 20 milligram in 1 ml solution. So we have to make 60 milligram in 60 ml syringe. This means that 1 milligram per ml. Okay, so just same like we made all the 1 ml is equal to 20 milligram. So we make 20 ml by adding 19 ml of normal saline. We make it 20 ml 20 milligram. So 1 ml is equal to 1 milligram. In the same way we will make it 60 milligram is equal to 60 mLs, right? So we will start the infusion at a rate of 10 mLs. So 10 mLs is equal to 10 milligram per hour. So we have to double the dose every 20 minutes, aim for the systolic less than 150 and a diastolic less than 100. If the systolic is less than 140 or the diastolic is less than 90, then we have to stop the infusion. The maximum that we can give is 40 mLs, which is equal to 40 milligram. The contraindication to hydralazine is maternal tachycardia that we already discussed, 120, more than 120. If maternal heart rate is more than 120, hydralazine cannot be used. Labetalol is preferred in this situation, so this may reduce the blood pressure and reduce the heart rate. This is all about the drugs for the antihypertensive medications for the hypertension in the pregnancy, which we can use in the antenatal period. Later on I will be discussing about the magnesium sulfate protocols and the postnatal medications. Thank you for watching.